Disorders due to substance use, drug addiction. Disorders due to substance use include disorders that result from a single occasion or repeated use of substances that have psychoactive properties, including certain medications. Disorders related to 14 classes or groups of psychoactive substances that have important clinical and public health consequences are included, and categories are also available for other specified substances. Typically, initial use of these substances produces pleasant or appealing psychoactive effects that are rewarding and reinforcing with repeated use. With continued use, many of the included substances have the capacity to produce dependence. They also have the potential to cause numerous forms of harm, both to mental and physical health. Disorders due to harmful non-medical use of non-psychoactive substances, for example, laxatives, growth hormone, erythropoietin, and non-steroidal anti-inflammatory drugs, are also included in this grouping. Substance classes. Disorders due to substance use are classified by first identifying the substance used. Available substance classes included are listed below. 6. C40 disorders due to use of alcohol. 6. C41 disorders due to use of cannabis. 6. C42 disorders due to use of synthetic cannabinoids. 6. C43 disorders due to use of opioids. 6. C44 disorders due to use of sedatives, hypnotics or anxiolytics. 6. C45 disorders due to use of cocaine. 6. C46 disorders due to use of stimulants including amphetamines, methamphetamine or methcathinone. 6. C47 disorders due to use of synthetic cathinones. 6. C48 disorders due to use of caffeine. 6. C49 disorders due to use of hallucinogens. 6. C4A disorders due to use of nicotine. 6. C4B disorders due to use of volatile inhalants. 6. C4C disorders due to use of MDMA or related drugs, including MDA. 6. C4D disorders due to use of dissociative drugs including ketamine and phencyclidine, PCP. 6. C4E disorders due to use of other specified psychoactive substances, including medications. 6. C4F disorders due to use of multiple specified psychoactive substances, including medications. 6. C4G disorders due to use of unknown or unspecified psychoactive substances. 6. C4H disorders due to use of non-psychoactive substances. Diagnostic categories that apply to the various classes of psychoactive substances. Following is a list of specific diagnostic categories that apply to the classes of psychoactive substances listed above. Episode of harmful psychoactive substance use. Harmful pattern of psychoactive substance use. Substance dependence. Substance intoxication. Substance withdrawal. Substance-induced delirium. Substance-induced psychotic disorder. Substance-induced mood disorder. Substance-induced anxiety disorder. Substance-induced obsessive-compulsive or related disorder. Substance-induced impulse control disorder. Other specified disorder due to substance use. Disorder due to substance use, unspecified. The first three diagnoses listed above, episode of harmful psychoactive substance use, harmful pattern of psychoactive substance use, and substance dependence, describe the use pattern of the substance. One of these three diagnoses, or disorder due to substance use, unspecified, for cases in which the use pattern is unknown at the time of evaluation, is considered to be the primary diagnosis. That is, one of these four diagnoses must be given when making a diagnosis of a disorder due to substance use. The remaining diagnoses reflect the impact of the substance use pattern, and are thus considered to be associated with one of the primary use pattern diagnoses. These diagnoses should therefore be assigned together with the relevant primary diagnosis. For example, 6C49.1/6C49.1 is harmful pattern of use of hallucinogens associated with hallucinogen-induced psychotic disorder. These hazardous substance use categories are not considered to be mental disorders, but may be used when the pattern of substance use appreciably increases the risk of harmful physical or mental health consequences to the user or to others to an extent that warrants attention and advice from doctors, but no overt harm has yet occurred. Additional categories of disorders induced by psychoactive substances are included in other parts of the ICD-11 chapter on mental, behavioral, and neurodevelopmental disorders. These categories relate to substance-induced catatonia, substance-induced amnestic disorder, and substance-induced dementia. They are cross-listed in the section below on substance-induced mental disorders for reference. Diagnostic categories that apply to the various classes of psychoactive substances. Episode of harmful substance use, essential features. An episode of use of psychoactive substance that has caused clinically significant damage to a person's physical health or mental health, for example, substance-induced mood disorder, or has resulted in behavior leading to harm to the health of others. Harm to health of the individual occurs due to one or more of the following: 1. Behavior related to intoxication. 2. Direct or secondary toxic effects on body organs and systems, or 3. A harmful route of administration. Harm to health of others includes any form of physical harm, including trauma, or mental disorder that is directly attributable to behavior due to substance use intoxication on the part of the person to whom the diagnosis of episode of harmful use of substance applies. Harm to health is not better accounted for by another medical condition or another mental disorder, including another disorder due to substance use, for example, substance withdrawal. Note: harm to the health of the person to whom the diagnosis applies includes injuries caused by behavior related to intoxication, for example, impulsive aggressive behavior, psychomotor impairment leading to injury. Acute health problems resulting from substance use, for example, overdose, acute gastritis, the effects of hypoxia or prolonged hyperactivity or inactivity, and exacerbation or decompensation of pre-existing chronic health problems, for example, hypertension, liver disease, or peptic ulceration. Harm may also result from a harmful route of administration, for example, injecting drug use causing blood-borne virus infections, cocaine use causing a perforated nasal septum. The relevant diagnostic codes from other chapters of the ICD-11, including the chapter on injury, poisoning or certain other consequences of external causes, should be used to describe the specific health consequences of the harmful substance use. Harm to the health of others includes any form of physical harm, including trauma, for example, impaired driving causing a motor vehicle accident, assaultive behavior leading to bodily harm to another person, or mental disorder, for example, post-traumatic stress disorder arising from an assault by the intoxicated individual, that is directly attributable to behavior due to substance intoxication on the part of the person to whom the diagnosis of episode of harmful psychoactive substance use applies. Additional clinical features. There must be explicit evidence of harm to self or other. There must also be a clear causal relationship between the harm to health and the episode of substance use in question. Substance use commonly occurs in the context of other mental disorders. Boundary with normality. 1. Mild hangover, brief episodes of vomiting, or transient depressed mood, does not qualify for episode of harmful use of substance. Differential diagnosis. 1. Hazardous use of substance. 2. Harmful pattern of use of substance use. Substance use is generally considered to be following a pattern if there has been at least episodic or intermittent use over a period of at least 12 months. 3. Substance dependence. Substance dependence includes additional features of dependence criteria. 4. Substance intoxication. Recovery from substance intoxication is generally complete, and without physical or mental sequelae. If there is continuing damage or harm, for example, the effects of hypoxia, the effects of prolonged hyperactivity or inactivity, tissue damage, due to an episode of substance intoxication, a diagnosis of episode of harmful use of substance may be assigned. 5. Substance-induced mental disorders. Substance-induced mental disorders can be associated with a single episode of substance use. If a substance-induced mental disorder has occurred as a form of harm resulting from a single episode of substance use, both episode of harmful use of substance and the relevant substance-induced mental disorder should be diagnosed. For example, episode of harmful substance use with substance-induced psychotic disorder. Boundary with overdose. When ingestion of psychoactive substances results in symptoms of overdose, for example, coma, life-threatening cardiac or respiratory suppression, a diagnosis from the grouping of harmful effects of substances in the chapter on injury, poisoning or certain other consequences of external causes should also be assigned. Thanks for watching. Please like and subscribe.